So you mentioned getting ulcerative colitis after traveling abroad when you were 21. How many years ago was that?
Gosh, when I was almost 21, well, I'm now 34 years old, so I guess that would have been, 13, almost 14 years ago, in the summer of 1999.
And where did you go when you were traveling?
I went to South Africa. My father's a professor, and so the rest of us went over there while he was teaching a class as part of the University of Florida. So I went over to join the rest of my family.
And, okay, how and when were you diagnosed?
Well, the onset of the illness started while I was actually in South Africa. So it would have been June of 1999. And I was officially diagnosed as soon as I got back in the United States.
That's not a fun vacation there, my goodness.
No. I mean, we had, 5 people, I think myself and my brother and sister, who were also both adults, living in a relatively small apartment in Cape Town, South Africa, for about a month. So it was kind of close quarters. And but the illness started with basically bloody urgent diarrhea, which was not good when we only had 2 small bathrooms to share in this place, and also redness in my eye as well, which at first I thought was maybe pink eye, maybe it was from some dust when we were driving in the country or something like that. It turns out later that this was a secondary symptom of ulcerative colitis. In about 2% of cases, and about 3% of people with Crohn's disease, what will happen is you'll have symptoms outside the digestive tract. This can include irritation or redness in the eyes, which can be treated with prednisone or steroidal eye drops if necessary. And also you can get small blisters or ulcers inside your mouth as well.
Are there any other symptoms that you can list?
Symptoms besides urgency, diarrhea, besides sometimes noticing the muscles spasming. It was kind of like in the movie Aliens, where they have those things inside them ready to like burst out. It was kind of scary sometimes to see the muscles spasm like that. So definitely, my body was not happy. But outside of the intestinal area, it was mostly some small ulcers in my mouth and redness in my eyes. Otherwise, I was actually doing pretty well. The illness itself wasn't usually too painful, except for the bloating and urgency of diarrhea.
So once you had this diagnosis, how did it change your life?
Well, I had always had a somewhat irritable bowels, irritable digestive system, almost from the day I was born. I was a bit of a colicky baby, and I had frequent ear infections as a kid, which led to frequent antibiotic treatment. In retrospect, this may have actually contributed to irritable bowel syndrome in me, as well as a family history. So I don't think anyone in our family was necessarily good at dealing with emotional stress to begin with. We had, the stoic, typical kind of Caucasian way of dealing with things, which can be hard on irritable bowels. So that was part of what was going on. But so it didn't really change things too much, other than being even more of an inconvenience than I'd already had. I'd already had, relatively frequent diarrhea growing up. Except now, it was sometimes 10 times a day, and I was losing significant amounts of blood, which I later learned to counteract by taking high amounts of iron supplements. So that was the main difference. Another difference was the drugs used to treat this illness. I was on high doses of prednisone, up to 60 milligrams, which caused me to have a moon face, as they called it, or chipmunk cheeks. However, I did not gain a lot of weight because I'm a bit hyperactive, have a high metabolism, so I burn a lot of calories. And I was also told the inflammation was high enough that it was also boosting my metabolism. And so, therefore, I had so much inflammation and so much sort of activity that prednisone actually did not make me fat. So the main change was just having to go to the bathroom more often and having to take these drugs and deal with the drug side effects, which included insomnia and also making me even more keyed up.
Okay. So my next question for you would be, once you had the diagnosis, what kind of treatments have you received over the years?
Well, I've tried almost every major treatment known to man. So this would have included a bunch of different things. It included, of course, prednisone and Azicol when I was first diagnosed. So started with 40 milligrams of prednisone, went up to 60, which, as far as I understand, is pretty much about the maximum dosage level usually.
Yeah.
And just to put this in perspective, if someone gets poison ivy, for example, they might be on 5 or 10 milligrams for maybe 2 or 3 days and then taper off of it. I was on 60 milligrams for 3 months, and this was while attempting to go to college. I had decided to resume going to college, transferring into American University as planned. So I was determined not to let the illness slow me down, even if I was facing difficult symptoms. I thought it was better to keep going rather than put my life on hold. So I tried Azicol, I tried prednisone. I was then given Cipro. Cipro made me better. So even though this is widely considered to be an autoimmune illness and no known pathogens for traveler's diarrhea or any other parasites were identified, it responded to Cipro, which is used and given to people oftentimes with traveler's diarrhea. So I asked the doctor, I said, if a powerful antibiotic that kills all the bacteria in my gut made me better while suppressing my immune system by using prednisone, and anti-inflammatories like Azicol did not work, isn't the problem bacterial? And the doctor said, well, I can't argue with your line of reasoning, but we really don't know. We think maybe the bacteria is secondary or it somehow contributes to the immune response here. But Cipro made me better. Over the years, I tried other treatments, including Remicade, which is administered intravenously in a hospital infusion clinic. And this made me realize that I was fortunate. I saw people that were dying of cancer. Actually, a poor kid in his upper 20s. I offered to take him out with me to some of my meetup groups and things. And he seemed like a neat kid, but he didn't seem to be doing too well. On the flip side, I saw some people that were very positive, optimistic people that had managed to overcome chronic illnesses and cancers. And I realized that some of these people that are successful in overcoming chronic illnesses oftentimes do have a great sense of humor and a really positive outlook on life. So I tried prednisone, I tried Azicol, I tried antibiotics like Cipro. Another time I was placed on vancomycin after Remicade caused me to have skin infection.
No, the roommates are coming home.
Okay.
We can keep. How did you come across the fecal bacterial treatment that you used?
Well, it's funny. Over the years, I knew antibiotics had helped me. So drugs that wipe out all the bacteria, like Cipro and later vancomycin, made me better. And very, very quickly. I mean, literally within a day, I got better.
Yeah.
I also knew probiotics helped. I took high doses of VSL number 3.
Okay.
Literally 8 trillion bacteria per day. I cultured my own yogurt using a yogurt maker. I stretched this out because it cost almost $1,000 a month. I spent $1,000 a month on freeze-dried bacteria. So that was a big thing. But then in January, January 2011, I was contemplating surgery. In fact, I've actually had a scheduled surgery date. So I read an article in Slate.com about, the title was "The Enema of My Enemy is My Friend." I was like, what? What the heck is that about? Because Slate has some pretty catchy, headlines. So I looked at it. I said, fecal bacterial therapy, stool transplants, can be a cure for colitis caused by Clostridium difficile bacteria. So I said, well, this is interesting. I haven't heard of C. diff before, but it's C. diff colitis. That means it must be similar to ulcerative colitis that I have. Well, sure enough, these people had infusions of stool using an enema, and within a couple of days they were better. This was after several rounds of antibiotics had usually failed, and these people were oftentimes facing severe weight loss, secondary complications from the illness, some of them potentially life-threatening as well. In fact, this actually has contributed as a secondary cause to some people actually dying from it. So I found out about this, but it didn't mention anything about ulcerative colitis. But I was thinking about it. Well then, 3 days before my scheduled surgery date, about a month or two later, I realized that things were working out for me here. I found the Wikipedia entry for ulcerative colitis, and it linked to an article that mentioned 6 patients that Dr. Barotti had treated with ulcerative colitis that were now completely better, completely free of symptoms, anywhere from 1 to 13 years later. without any dietary restrictions, without taking any more drugs. Now, this blew me away. How can this possibly be? How can it be that this illness can just be cured when they've given me all of these drugs, none of which even promised a cure? They would only possibly bring the illness into remission. They would temporarily make the symptoms better as long as I took the drugs, not actually cure the illness. How could this be? So I read the case studies, and they were well documented. The cases have been pretty severe. They had resisted most other drug treatment options. Many of them were quite similar to mine. And that is when I found out about this in March, 3 days before my surgery date. So this looked credible. And so I canceled surgery, determined to try this for myself. And I wanted to try it soon, because maybe it wouldn't work. But I wasn't, I wasn't going to allow myself to have surgery, which was irreversible, before making sure I'd exhausted every other possible treatment option. And sure enough, this ended up working spectacularly well. This is after every other major drug that can be prescribed for this had failed to be effective.
Okay. So now, in order to do this process, you obviously have to find a healthy donor who has healthy stool, and you came across Elliot, who wound up being your roommate. So now, describe your experiences with your living with Elliot and him being your donor.
Well, it's quite interesting because Sarah, you know firsthand about this. So, of course, for one of my businesses, after being a management consultant and working in corporate sales and other jobs for years, I started a dating coach business and actually published a book on that before. Well, admittedly, this hasn't always been, a big time business, but it's been a lot of fun. And I've met some really great people and really got to bond with my various clients. So my donor, Elliot, was actually one of my clients, and he became very successful at this and ended up later moving into a career in sales. And so I decided to ask him, because other people in my family, there was a family history of irritable bowel syndrome, so I wondered if they would be good donors. And I didn't want to disrupt and put my life on hold. I wanted to stay here in the Washington, D.C. area, close to friends and jobs and other things like that. So I went for a walk with Elliot. I knew he was a pretty open-minded guy. You might consider this. We went for a walk up near Great Falls on the Billy Goat Trail. So we're hiking along, and he's telling me about a recent trip to Montreal that he'd taken. And he knew about my illness a bit. I'd explained that. And so I told him what I wanted to do. I said, well, actually, I'm looking for someone who might be a donor now. And so I was wondering if he'd be willing to, get an apartment with me, become roommates, because this might take a while. It might take a month, 2 months, I don't know. But it would be really convenient to live with my donor. So I asked him if he'd be my donor and roommate and get an apartment together. So he asked me, he's like, well, so all you need is my poop, right? I said, yeah. It's like, well, will this involve anything invasive? Are they going to, stick any probes in me or anything like that? I said, no, basically just need a stool sample a day. I said, oh, well, I wasn't going to do anything with it anyway, And he said, okay, if all you want is my poop, that's I can do that. So we quickly got an apartment together and moved in, and he became my donor. And once again, we were determined to live our lives. I was in my early 30s, he was in his late 20s. We had jobs. Live our active lives without letting this slow us down. So if he wasn't in the apartment at the same time I was, he would just put the stool sample in the fridge, and we could store it for up to 5 or 6 hours. And so this enabled us to coordinate things. He didn't always have to be there at exactly the same time.
Okay.
And it was a good lot of fun. And over time, I got comfortable enough with this that once I had administered the enema, I could just kind of lie around and let it sit there and continue talking to people. And so, as you know firsthand, Sarah came over and visited, and I'm just, laying down with my legs up against the wall to kind of help retain the enema. I'm just, hanging out in the living room talking to you and Elliot. And so that was the thing. I was determined to, not let this slow down my life. And that was the process of that. And I'll give him a lot of credit. Elliot appreciated the circumstances I was facing, which otherwise would have been surgery. and was very willing to help me out with this. And fortunately, his stool proved to be very good, healthy stool, and I got better pretty rapidly. It was about 6-7 weeks when I had a major breakthrough, and the illness almost completely dissipated within a matter of about a day or two.
Okay. So now, you described many complicated regimens, medical regimens that you had to follow during this process, especially when you were doing the enemas and whatnot. Are there any prescriptions you had to take at the time, or how did you obtain what you needed to do these enemas?
Okay. Well, there were a bunch of different ways to go about things. At first, I was considering actually working with a doctor here. And I did call some doctors from that original Slate.com article, The Enema of My Enemy is My Friend, and had scheduled to do the procedure with one of them. However, over time, there were some delays I reached. It was hard to get hospitals who agreed to do it and other things like that. So I ended up doing things myself. While many protocols describe pre-treating with antibiotics to clear the colon of other bacteria, I ended up skipping those since I didn't have a doctor to prescribe them. Also, in terms of making sure I picked a healthy donor, I used the doctor's questionnaire, and also my donor had recently been, tested for some other illnesses. But in many cases, if the illness was something that would have presented symptoms within a specific time window, we didn't always test for every single last possible pathogen if there was no reasonable chance the person would have it. In terms of other drugs that helped me out, I actually ended up discovering some from a psychiatrist. I go for stimulant drugs for attention deficit disorder. It turns out that some antidepressant and anti-anxiety drugs are used to treat irritable bowel syndrome. They can actually help slow down and calm diarrhea and muscle spasms. So I went to a psychiatrist when I read about some of these medications, such as Wellbutrin, bupropion, and he gave me the prescription for that, and then said, well, if you're having trouble sleeping at night from prednisone, here, why don't I give you this? Kind of his drug of the month. He had a whole stack of these boxes for this drug called Silenor, which was actually a low dose of an antidepressant that had been, invented 50 years ago, called Doxepin. And that ended up calming down my gut. The addition of those two antidepressant drugs caused everything to just kick in, and within a day, I had normal bowel habits, which for me was very highly abnormal. So by calming down the muscles in the gut, you can actually slow down diarrhea and calm muscle spasms. And that in turn can help the newly transplanted bacteria take over and finish healing the illness.
So now this is a fairly unconventional treatment, and I know that with my experiences with my father, as I've told you about in his colitis, when I would talk with the doctors about this, it seems that most doctors are not on board with this. Do you think that's starting to change a little bit more, or do you think that most doctors are still more about, let's go for the conventional treatments?
It's been my experience that as a bunch, and I'm making a generalization here because this doesn't describe all doctors, gastroenterologists tend to be a relatively conservative bunch. They don't want to use treatment options that they don't believe have a very solid, kind of established track record. Part of the reason for this is the success rate for a lot of the approved drugs for ulcerative colitis is not that high. And so I think there's this sort of fear that they don't want to do something that's not going to work unless they can say, well, this is what everyone else is doing. This is what the pharmaceutical companies and the guidelines say we should do. However, when it comes to fecal transplants, in addition to, I'd say, sort of a cultural bias against dealing with stool, the FDA has now decided to regulate fecal transplants as a biologic drug. This is the same category as drugs like Remicade, Humira that you have to be given intravenously in a hospital. So you have to get an investigational new drug permit, also known as an IND, to do these if you're going by the letter of the law with the FDA. This has been somewhat ignored by a lot of the pioneering doctors, but the FDA started to crack down on this more and more. In addition to that, a lot of hospitals even discouraged it, even if a doctor wanted to go through with it before. However, these FDA regulations and other hospital rules have actually gotten in the way and discouraged doctors from doing this. They would have to apply, then they'd have to wait a month, then they'd have to do lots of extra paperwork. And all of this for a procedure that does not really make a lot of money for a doctor. It's the same as doing a colonoscopy, except now they have all these additional complications. And so, like in the case of your father, there are many things that a doctor would have faced to do these, including the possible disapproval of his superiors at the hospital where he works at, and other doctors and people in his group. And he would also have to deal with the FDA to gain their approval if he was doing things by the letter of the law. So you either need kind of a maverick doctor, kind of like House, who's going to be a bit of a renegade, knowing that this works, knowing that there are well-established protocols, knowing that its safety and effectiveness is very clearly documented in some case studies and articles. They would go ahead with this. However, in light of these various restrictions, at this point, for most people, doing this in a timely manner is going to require doing it themselves for the foreseeable future. And for example, if you're dealing with a patient from, say, our parents' generation, maybe in their 60s or 70s or 80s, that are used to just following along with what the doctor wants, that's oftentimes going to be very, 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 very difficult to get them to do something against that. And that's
that was
exactly
my father.
It's your father, right? He wanted to do just like the generation above us. It's like, well, I'll do what my doctor says. They're the expert on this, right? I should trust them. And that is definitely quite a challenge and a problem. And unfortunately, I think this, the FDA's investigational new drug permits regulations are really getting in the way of allowing doctors to do this. And once again, that is why so many people are turning to do it themselves. The good news is, if you have healthy stool that's free of infectious diseases, this is very safe. It is unlikely that you're going to get any sort of incurable infection. In a worst case scenario, even if you did end up with some sort of infectious pathogen, it could probably be cured with a healthy stool transplant. Yeah. But unfortunately, like in your father's case, what you found is that oftentimes doctors keep prescribing antibiotics
over and over again.
Over and over again. And what happens is each time you don't knock out all the bacteria, it gets stronger. It keeps coming back stronger and really can kind of weaken the body and create secondary problems.
My next question is for you, because it isn't, even in my own research, I didn't come across a whole lot of information out there. So why did you decide to create this blog and go public with your own story?
Well, part of the reason I went to was I was literally 3 days away from having surgery to have basically my large intestine and rectum completely removed in one surgery. Then they were going to take part of my small intestine and make what's also known as a J pouch, a small reservoir, like a substitute large intestine, and then pull through part of my small intestine through my stomach, connect it to a bag for several months, and then have a second surgery to reconnect it, and then reteach myself how to go to the bathroom, reuse those muscles, re-potty train myself. Was it going to be the end of the world? No. Would I have found a way to, continue to live my life and have fun? Presumably, hopefully. But this would have been a major impact. I wouldn't have been able to work for months. I would have been dependent on others for my care while I recovered from surgery and while I learned to go to the bathroom again. And the best case scenario from surgery was I was going to have to go to the bathroom 5 or 6 times a day for the rest of my life and make sure that I didn't eat anything that had too much fiber in it. Too many big leafy vegetables or nuts could clog the new smaller large intestine I have and create other problems. So this was going to be no cupcake. Well, once I read about this, these case studies I saw were very, very convincing, and they resonated with my experience, which was bacteria did play a role. I knew it. It played a role when antibiotics cured me at least 2 separate times. I knew it when probiotics had helped me. So I knew this stood a good chance of working. And in terms of going public, I realized that other than those few case studies published in the Journal of Gastroenterology, that no one else had really come forward in a way where they kind of documented their story. So I wanted to do this to get it out there and to spare other people having to have surgery for myself, which really, it alters your body. I know they say that the prognosis is good for people living a healthy and happy life, but it's a major, major interruption. And then also the fact that other people are actually dying because the doctors say, oh, there's nothing substantiated out there. And so I wanted to get through to those people and say, hey, look, you have a choice here. Here is the evidence. This is not quackery. This is exactly what I did, and these are exactly the results that I got.
So now how do you think people have responded to that? Like, have you gotten more emails, more questions about things, a positive, negative response? Okay.
Definitely strong positive response. Now, I know a lot of people's knee-jerk response to this at first was, what? Or, ew, that's disgusting. But then when you stop to think about it, for people who have actually had this illness, the illness of having chronic bloody diarrhea is really not pretty. I think anyone who couldn't make it to the bathroom on time and literally pooped their pants, or were afraid to go out of the house for fear of pooping their pants, realizes that the illness itself is pretty bad. And so compared to the illness itself, the treatment is not that bad, and it does make sense. So I've actually gotten a pretty strong response. I've gotten hundreds of comments on my blog, and gotten about 3 or 4 or 5 new people a day buying my ebook, which tells exactly how to do this step by step and explains my story in more detail.
What's the title of your ebook and how can people purchase it?
Oh, well, it's available on my website at www.fecaltransplant.org, and I call it Fecal Transplants Cured My Ulcerative Colitis. Now, one thing I know a lot of people say is, well, you're one person. You're not a double-blind, placebo-controlled study or anything else like that. That is true. So, from my perspective, I can't say I'm a doctor or a researcher who's been studying poop for 10 years. Mm-hmm. I can say I'm one person that read the best research that he could, and I can tell you exactly what I did. I can tell you that it worked. After over a dozen years of every single other drug I tried not working, this includes drugs that cause cancer, drugs that cause diabetes, drugs that cause bone density loss, drugs that cause cancer, none of those drugs worked. And now, for 2 years, I have been symptom-free and free of all medications, and I don't even watch my diet much anymore. I eat and drink whatever I want. And so I think the fact remains this, for me, has essentially been a permanent cure where nothing even close to that had existed previously. And this is something that I want anyone who's ever suffered this kind of illness or had to deal with it by being a caregiver would want, is to be free of this illness once and for all so you can get back to living your life.
So now, besides your ebook, are there any other resources that you can recommend people go to if they want further information aside from the ebook and your blog?
Sure. In addition to my website and my ebook there, some other good ones include the powerofpoo.com. This also has a secret Facebook group, which you can email the person who runs it to go ahead and join. So thepowerofpoo.blogspot.com, and then from there you can find the Facebook group where there's some very, very advanced discussions, people constantly sharing information and articles. In addition to that, I would look for the research of Dr. Barodi and his website, I believe, cdd.au. It's if you look for the Center for Digestive Disease in Australia with Dr. Barodi, you'll find dozens of articles that he's published in the Journal of Gastroenterology and other peer-reviewed journals. And this is what convinced me. It wasn't just reading an isolated patient case here or there, or someone's speculation on an online forum. This was reading an article published in the Journal of Gastroenterology, treatment of ulcerative colitis using fecal bacterial therapy, available through Dr. Barodi's website. So that, I would say, is one of the strongest resources. Of course, links to those are found both on my blog and in my book. But I would also go to Dr. Barodi's website directly.
Okay. Thank you, Michael, for taking the time to share your story.
All right. Thank you.